I'm a pretty sporty person, and sport means a lot to me. I'm pretty much an outdoor sport guy, and I really enjoy doing different outdoor sports in summer and winter time in all seasons. The day it happened 1 year ago, it was one of these epic days. It was a really perfect powder day. Just on the chairlift, we told to each other it's one of our happiest days, and it's perfect, fresh powder, blue sky, friends are coming in, and yeah, it was just one of the happiest moments, and yeah, it turned into another day. I was the first who started the descent, and I just went below a little hill, and I hit a rock underneath the powder snow. I couldn't see it. It was a really heavy crash on my side, and immediately saw my leg was on the wrong side. It was twisted, and then at that moment I didn't realize that it was that heavy impact and such a complex fracture. Then I as fast as possible took out my smartphone and called the Riga.
So I met Mr. Mattli when he came in on the emergency station as a patient. He came to us transferred by the regional hospital in Davos, where they made the primary management of his injuries, and they sent him to us because of the seriousity of his injuries. We had the two difficult fractures, unstable pelvic fracture, so a symphysis disruption in combination with a vertical shear type fracture, in combination with a multifragmentary trochanteric fracture on the same side of his femur. First of all, we had to be sure that he's not bleeding, but as he was stable, not really bleeding, we could treat both fractures immediately. So as an early total care. And we decided first to fix his femur fracture on a traction table, and then we followed treating his pelvic injury with a plate on the symphysis using a stopper approach, anterior stopper approach. And as he was still stable, in a good condition, we put him in a prone position and did an open reduction and double plate fixation of his vertical sacrum fracture. Fortunately, he had a very good and early recovery and a good outcome, finally.
I had good luck that it was only the leg and it wasn't the back or the head. And I have really good chances to get back on my legs and walk and do sports again.
So in the many courses I was involved as a participant and mainly as a teacher, faculty. I got a very good education treating even complex fractures. So how to analyze the situation, for instance, that's very important, that you analyze it step by step, that you make your preoperative plan. So especially in this case of Mr. Mattli, with the two difficult fractures, you really have to plan how you proceed during surgery. And I remember even very detailed single cases, and that's 20 years ago or more. So I think that's the real value of these AO courses, especially Davos courses, because these are global courses and you have the best teachers from all over the world together there.
I was walking 4 months with the sticks, and then I started walking, with the biking again, and I was surprised that in July I already could do mountain bike tours without pain. I'm still in physio and do trainings, but I really look forward to go skiing and try it again.
It's now 1 year after injury. He has a very good function due to the fact that the surgeon who fixed his fractures had a very good education using the AO principles. I think he has a good function now. As I know how much I got from the AO course in Davos, for instance. I'm very keen to teach the youngest generation of surgeons as well, as I was taught by Joe Schatzker, Thomas Rüedi, and all the other famous AO people. If I have once a fracture, I want to have a good surgeon, and I would like to have one who is got his education in the AO courses.
I was also thinking, what would have happened 20 years ago or 25, 30 years ago? How would they have treated such an injury, and would have been possible to walk again?
I think AO provides education that improves measurable patient outcome. Let's say in this case, the outcome maybe is even higher than my expectations I had before I treated him.
For me, this is one of the biggest progress in our society, how you can treat fractures like that and how fast you get back into normal life. For me, it's really magic.